Hello, everybody. Today's training is on patient privacy, confidentiality, and HIPAA compliance in the home care and hospice setting. My name is Dr. Lynn Klima, and I'm a nurse practitioner who's going to be doing your training today. I have over 40 years of nursing experience across both acute and primary care settings, also community care. And I am also faculty at the University of Olivet and the Patient Safety Officer for Coffee Plus PSO. We have no disclosures for this training, and as always, this course is not a substitute for legal advice for any individual provider or situation. Always consult your company's legal or compliance personnel with any questions or concerns related to any subject matter. Our objectives today are to recognize the laws on privacy information, health, otherwise known as Health Insurance Portability and Accountability Act, otherwise known as HIPAA, identifying potential consequences of breaching confidentiality, and discussing strategies for maintaining patient confidentiality in various healthcare settings. This all really sort of starts with, just kind of as a reminder why we need to do this from a CMS, so the Centers for Medicare and Medicaid requirements. They are conditions of participation for us. And in order to become certified or maintain certification for Medicare and Medicaid, um, as providers in home care and hospice settings, we must be certified to receive reimbursement for the services that we provide. And then also, it falls within our patient rights. We have to assure that our patients' rights are protected, including the right to make informed decisions about their care. So, when we think about regulatory compliance, what we're required to do as organizations is one, make sure that we're informed of what those regulations are, which means being, taught and having a regular review of what the latest federal, state, and local regulations are that govern our services. That we have a process to implement these, these requirements through policies and procedures, and so that we assure that we know what we're supposed to be doing and how we're supposed to be doing it, and that communication is done through staff training. And then we as organizations and team members need to participate in a double check, right? Are we doing it? And we can see that through auditing. Are there any opportunities for improvement or gaps that we need to address? And then we want to make sure that we're keeping good records, documentation, that we have policies, that staff have been trained on the policies, and we all know what those requirements are for that to assure regulatory compliance. So, okay, we're going to start off with talking about just patient confidentiality and our legal and ethical obligations related to that. So, patient confidentiality is a fundamental principle in healthcare that refers to the ethical and legal obligation to protect a patient's personal health information. This includes any data that can identify who the patient is, such as their medical history, their test results, their treatment plans, and personal identifiers. And we can maintain that patient confidentiality in a way that's, important, that the patient recognizes that this is an opportunity to trust us, right? It's a trust building step in our relationship between them, our care team members, and the services that we're providing. And they need to know that their information is protected and sensitive, and we're only going to share information as a result of the need for ongoing care and treatment. So when we're thinking about patients' rights within the context of this confidentiality, patients have the right regarding their personal health information, including their own rights to access it, to know that it's being kept private, that we're doing whatever we can to inform them when we're doing, test procedures and services, that they know what to expect. They're informed about that. They have the ability also within this to refuse treatment. And we have to be respectful of these rights and uphold them to make sure that we're maintaining that trusting relationship and providing that patient that autonomy or that independence to make decisions that are right for them, and the services that they want to receive. So again, the right to access their health information. That means that they can have copies of their medical information, their records. They can also request changes to it if they've reviewed it and they're not agreeable to what they've written in or what's been written in there. They also have the right to privacy and confidentiality. So that means that their personal health information must be kept private and secure with limited access and disclosure only to those people who need that information to be able to help support the patient in their care. A right to informed consent is the patient has the right to be informed about what their conditions are, what their treatment options are, the risks and benefits of all those treatments, and then they're making that choice, right? That's best for them. And then the right to refuse that treatment. So we sometimes don't recognize that, but that is one of those, the rights to maintain their autonomy. So when we think about confidentiality within this context, HIPAA requires us to maintain the confidentiality of patient information and limits access to only those providers that need it for their, to be able to be involved in their care. And we have to protect their privacy. We have to, have processes in place that have, we're make sure we're, keeping track and secure the physically, that information that's there. We have to make sure that we have administrative policies that are protecting that data and technical safeguards so that we're not arbitrarily, you know, putting out pieces of information that are going to get out to other people. Authorized access. So we have to have policies and procedures that allow those patients to know that the information that we have is only going to be shared with those people in the healthcare team that need it, and that that information is under a policy that authorizes who those folks are and what information they can receive it. We also have to have, as a part of confidentiality requirements, we have to know what to do if a breach happens. We have to notify patients and the appropriate authorities in the event that there's a breach of unsecured protected health information. And then there are penalties, right, from an organizational perspective. If we fail to comply with HIPAA regulations, it can result in significant fines and penalties for healthcare providers. So there's a lot of weight associated with building that trusting relationship with our patients, and foundational to it is that they need to know that when they come to us, we're going to care for them, we're going to provide them the information that they need to make the best choices around their care, and that all of these conversations are confidential and protected, and the information associated with it. Now, when we think about where we're delivering services, it can be challenging no matter where you work in healthcare. But when you think about where we're providing care in the patient's home, it can also be a little bit, more challenging for us because of where we're providing that care. It's really critical for us in that home care and hospice setting. We often have, access to a lot of sensitive personal and medical information, and maintaining that confidentiality is crucial despite where we're providing that information. And so when you think about that home setting, oftentimes it feels or can feel more casual. And so it's a good reminder to all of us that we have to, keep HIPAA and that confidentiality, those confidentiality requirements sort of front and center. So some of the unique challenges that we have in the community that don't exist in, a physical building or a hospital, include, there are family members or caregivers that are around that might be friends that are, helping. Maybe there are family members that are helping act as translators, if we have, some issues with communication and understanding, and family members that, depending on the acuity and the severity of the illness of the patient, may have medical power of attorney, right? So there's a lot more fluidity, if you will, in terms of providing care in this space that can, sort of lull us into thinking that it's okay to share patient information with people that are there and not really think about, HIPAA in that regard. And so we have to remember that these rules apply to us as well, despite the setting that we're providing care there. So we have to make sure that we're aware of what are some of those situations and what can we disclose and to whom, and what information needs to be protected. So when you think about in-home visits, there's multiple environments. Home care staff work in diverse settings that lack any controlled variables in those environments, and that can, lead again, like what I said, to unintentional breaches of that confidentiality. There are family present, right? Oftentimes there's many people that are around that can, hear or overhear or see or read information that we might have. And, we all know, everybody who's worked in a home setting, there's limited space and privacy. And so, confidential discussions can take place and can be overheard. So we have to think about that as well. And then there are also emotional and psychological factors. As we're building those relationships with our patients, we want to make sure that we're not sharing inadvertently any personal stories or details that will compromise that confidentiality. We are privileged to get to know our patients in a deeper and a closer way than our colleagues in acute care settings, because of how we're in a patient's home, and that's a very personal experience. And so we tend to develop really very close relationships with them, and they share things with us, and we may share things with them. And we have to remember that we can't divulge anything that we're seeing, hearing, or learning about. And the other thing about home care and hospice is that these are also, stressful environments as well, and that can lead to, a lapse in judgment or oversight. Our workload, and how anxiety provoking situations might be, or the emergent issue, or the chaos that might be happening in the environment that we're providing care. And so we just have to, again, be aware of that it puts us at risk for sharing information inadvertently. Also technology, right? So everybody in healthcare now is using technology, regardless of what setting you're in. And the use of those electronic devices or smartphones to access patient information increases the risk of, unauthorized access to the devices if they're lost or mismanaged. And then also that internet connectivity, the inconsistent internet or Wi-Fi access may, have us do a workaround, right? Compel you to start to use unsecure networks or devices, maybe elevating our risk of data breaches, right? So when we have that technology issued to us with those passcodes, and the policies that we have to to follow related to the technology that we're using, logins and passcodes, and where we leave our computers and our devices. That is also a part of some of those risks that we might have. There might be training, right? Maybe there's variable levels of training. Staff might get different levels of training at different times. Maybe people are, a little bit lagging behind in getting their competencies done or their annual competencies done. Maybe policies haven't been updated, or they've been updated but they're not easily accessible. Um, Maybe you don't know what those policies are. Maybe things have been changing. Things change rapidly, right? And there's a lot of information to keep track of and follow, and so it can be difficult, right, to know what's current, right? And so being aware of, what are your organizational policies around protecting patient information, how you use your devices, how you communicate, what can be shared, how you know what those policies are and where you can access them so that you have them at your fingertips. So, just getting started is a foundation for all of us. The basics really are knowing what the laws and regulations are, and that's often an organizational directive, right? They are the ones that are accountable and responsible for knowing what they are, what their updates might be, if there's anything specific to your state that's outside of, the federal legislation, and they have that applied in current policies. Knowing also, that we have to, and how do we get informed consent and authorization, who ultimately makes those decisions and shares that information and educates with the patient so that they can make sure that they are truly making a choice that they understand. How do we know that they understand their treatment decisions and the risks and benefits of all the options in front of them? We have to make sure that we have a process in place to limit the access of that patient information. So it's a need to know basis. If you're a part of that team and that patient's not in your caseload, do you really need to have access to all of that patient information? Or if you have a certain role within an organization, and these are really where our policies and our sign in codes really can protect us because they do allow us to have limitations on who can see what and where in the record. Um, and then using secure methods and devices. So, what does your organization use for encryption, passwords, firewalls, antivirus software to make sure that the data and the devices that we're using are as secure as they can be? We also have to make sure that we're respecting patient preferences and their diversity. There's diversity that comes along with this, and everyone has different choices about who should be involved in their care and what they need to know. So that's a very important basic, finding out with your patient who's on their immediate list with their family members or their caregivers, and what do they want them to know. And maintain our own accountability, is that we have to be take responsibility for knowing what our policies are in our organization, and whatever your role is within your care team, what you're expected to do and how you're going to go about applying those confidentiality standards and to protect that patient information and adhere to those federal requirements around HIPAA. So how do we do this? What are some of the best practices that are out there? First is just education and training. And so beyond this, high level overview of HIPAA, how does your organization talk about HIPAA and compliance issues within your organization? There's the annual requirements that we all go through, but there's also the onboarding, what orientation and information you receive. But then how do you get information on a routine basis when there are changes to policies or updates with software and technology, or new technology is placed front and center, right? So it's important as a staff person to make sure that you have and attend those regular training sessions, and what your responsibilities are in relation to your role to handle that sensitive information. And then one great way to practice and apply. It's one thing to read a policy on paper or on a platform on your device, but it's another to actually walk through and simulate or role play different scenarios. And if you're a leader or a manager that's listening to this training, it's a great opportunity in staff meetings to do some micro learning around cases or examples. So if you're seeing quality improvement data, or incident reports come through, or you've heard something related to a patient complaint or a grievance, you want to bring in opportunities consistently, not waiting till an event happens, but consistently to build your staff's confidence in terms of knowing what is expected of them so they get some practice with them. Because sometimes, especially if they're newer or they're younger in their careers, or maybe are new to that particular work life, they may not realize, right? And so we as leadership staff have to be accountable to provide as many opportunities as possible to demonstrate and integrate the policy work and the expectations of the policies into what that looks like. So staff meetings, stand-ups, huddles, however, not just making it be a once a year thing, but using some opportunities to embed that knowledge into some skills and some practice. Um, the other is documentation, right? So making sure that we have securely stored records where our patient records kept. If you happen to have any paper copies, I know there are still some organizations that do have some paper components to their record, maybe not all of it. Protected password digital systems to prevent unauthorized access. Proper disposal of documents. So again, what does that look like if you do have documents that have protected health information on them? How are they shredded? Where are they shredded? Where is that, stored and kept and removed? And then electronic, wiping or cleaning of hardware to make sure that there's no you know data that can be leaked out of there. And one way to know if this is effective, again, not waiting until an event or an incident happens, but just doing the routine audits, regularly checking documentation practices and patient records for compliance with confidentiality policies, right? And so it's an opportunity to really be able to kind of take a eagle eye look at what's going on and see if there are opportunities for improvement or re-education, to be able to assure that we're protecting that information. And it's real easy to leave a phone around or a computer around, and we're having it open, get up, going somewhere else, maybe to go to the restroom if you happen to be in a building, and we want to make sure that we aren't doing that. So this is, the strength of our informatics departments, working on HIPAA compliant policies that support HIPAA compliant systems, with our EHR systems that comply with HIPAA regulations. I know we all look at our data sources and our vendors that we're using, and that's a big piece of that regulatory requirement integration into that data security and privacy and policies that go along with it. And then those access controls, right? What does each login allow folks to have, in terms of the required authorized personnel. And also, more of us have moved forward with implementing multi-factor authentication where possible again. So again, creating more layers to be able to protect that data. Patient education. So when we're forward facing with patients, educating them about how their information is used. We want to again build that relationship with them, the importance of confidentiality and letting them know that we're going to protect that information, but how they can contribute to protecting their privacy as well. So letting us know who is appropriate to receive information and what do they want to know, or maybe asking family members to step out, or when we're scheduling visits, maybe there's a time of the day that they would prefer so other people aren't there, or if they do want somebody to be there, right? So again, this is a part of that engagement with them to bring them as a part of that care plan, and then getting that in our documentation so that we know what's acceptable and who can be a part of that. And then consent forms, as much as we belabor a lot of the documentation that has to take place in these settings, and in all settings really, we have to make sure that we're taking the time to assess, did those patients really understand the treatments, their options, the risks and benefits, and that they're signing those consent forms regarding what they want to happen, but then also the sharing of their health information, and understanding their rights, what their rights are as they're related to privacy and autonomy. Um, some other guidelines for confidentiality around communication is, when we're thinking about the setting that we're providing care for patients in the home, or maybe even in a facility, if we're going in to do hospice care in a facility, we want to make sure to have those conversations about sensitive information in private settings away from family members or friends or guests, or people that might be visiting. Limit information sharing, share information on a need to know basis. Only discuss patient details with those directly involved in the patient's care with patient's permission. And then using secure messaging platforms, using those encrypted communication tools when discussing or sharing patient information with colleagues. So again, what technology do you use? Or do you have a texting service? Do you have an email service? It's not on our own personal devices. It's on issued devices, or through secure channels that have been authorized and sanctioned by our organizations to assure that they meet those compliance standards, right? So while we might want to do a workaround and get something done quickly, that can also put us at risk, right? So we have to operate within the confines of what our organizations have laid out for us in terms of the safest and most protective ways to communicate with each other. So let's just kind of talk a little bit about HIPAA specifically. So HIPAA is called the Health Insurance Portability and Accountability Act, and it is a federal law that aims to protect the privacy and security of sensitive patient health information and ensures its proper handling and use by healthcare providers and organizations. And part of that is making sure that sensitive patient information is protected, and is really across all healthcare providers, right? Everybody in healthcare that sees patient, that handles patient data, otherwise known as protected health information, is are held to these standards. And then HIPAA has set guidelines for the appropriate use and disclosure of protected health information and how we handle the technical aspects as well as those administrative safeguards. And it started in 1996, um, is where it was enacted to improve the efficiency and effectiveness of healthcare systems. And then in 2020, 2003, sorry, it was implemented establishing national standards for the protection of the identifiable health information. And then in 2005, it evolved into a security rule where it expanded to the implementation of the administrative, physical, and technical safeguards to protect electronic protected health information. And then in 2009, the High Tech Act came out, which was expanding HIPAA's reach and increasing penalties for noncompliance. And then in 2013, the Omnibus Rule was introduced, strengthening HIPAA's privacy and security requirements and expanding the definition of business associates. You can see the evolution of it. It's been around for a while. Historically, it has changed as times have changed, especially around, electronic data. Uh, back in the 90s, we were still using paper records. And so, as we evolved into the 2000s, we, transitioned to more electronic information and data sharing across organizations. And so, that's when, we see these rules change as we change in healthcare, right? As there are changes in healthcare. So again, we already talked about the HIPAA, uh, in terms of our work in with patients and helping us, establish that trusting relationship because patients are going to be more confident with the care that they're receiving if they know that the information that we're receiving from them and we're giving them, and it's all protected within that HIPAA Act, right? And that's necessary to be able to provide good care. It can also have financial implications. So the cost of noncompliance, including legal fees and fines, is just something to remind all of ourselves. I mean, especially if we're at the patient forward facing level, we may not realize the impact to organizations if there are breaches of data or data security issues. And so, we're a part of that. We want to make sure that we know what we need to do every day with the data that we're privileged enough to handle, and how do we, protect that so it doesn't get into the hands of people who don't need it. So again, our regulations in home care and hospice fall under those federal guidelines, the secure data storage and transmission, making sure that we have those policies, we have strict access controls, and that we have a process in place to really assess how are we doing, and that we're following and adhering to these policies as best that we can. And this is basically a recap of some of those same regulations. So when we think about privacy, the principles of HIPAA are that we're ensuring the confidentiality, and it requires covered entities to implement appropriate safeguards to protect the privacy. From a security perspective, we have standards for the security of those records. And again, talking about at that administrative level, how do we secure those records? The physicality of the records. So, nowadays that's through, whatever electronic device that we're using, and the technical safeguards. So, those data exchanges that we have back and forth with each other, as well as other systems or vendors that we might be using with the patient, and the the PHI, the protected health information, that we're making sure that we're protecting that. And then when we're thinking about breaches, right? So if a mistake happens or there was a data security issue that was identified or found, or somebody shared information that they weren't supposed to, we have to, we're required as organizations to notify not only the patient but also the Department of Health and Human Services, and in some cases, maybe even the media when a breach of unsecured PHI has occurred. I don't know if you've ever received a letter from anybody or you've heard on the news. It has happened. It has happened in healthcare, but it also happens in other sectors where data breaches are out there. So we want to make sure that we again understand that there are risks associated with not being adherent or following the policies that are there. So, what information is protected, right? So, how do we know? What can we say? When can we say it? Who can we say it to? So, the definition from CMS is that individually identifiable health information is information including demographic data that relates to the individual's past, present, or future physical or mental health or condition, what kind of care the healthcare is or the individual is receiving, and the past, present, or future payment for the provision of healthcare to the individual, right? So really anything about them related to their medical care, who they are, where they live, how you get in touch with them, and what's happened with their medical care, what's happened in the past, currently, what we're planning in the future, what diagnostic tests, what results, really everything in that medical record. And so we want to make sure that we are aware of the fact that we can't even let people know that a person is a patient of ours, right? I think about being in a community setting, and a lot of people know each other when you work in, different spaces. And so even acknowledging that so and so is a patient on your service, or that you've gone to do a home visit, something that you might think is really benign is critical to not share. You don't want to share that information. And we'll go through some specific examples here as we go through our presentation. Now, there are ways to permit use and disclosure of information. We, a covered entity as an organization, are permitted but not required to use and disclose protected health information without an individual's authorization under specific circumstances, right? So, number one, if the patient asks for it themselves, right? We don't need to have authorization from them to do that. They are asking for it. It is their information. We can give that to them. Treatment, payment, and healthcare operations, the opportunity to agree or object, incident to an otherwise permitted use and disclosure, public interest and benefit activities, and limited data set for the purposes of research, public health, or healthcare operations, which often are de-identified, right? So they might not have patient specific information, but it might be like around I'm thinking of an infection, or if we were monitoring, specific outcomes related to a research study. And so those patients have, data that might get sent there in a way that's blinded, so you don't see the name and the information of the patient. And some of these, when you think about them, these are information that is related to being able to provide their care and support their care in the immediate need, right? Covered entities may rely on professional ethics and best judgments in deciding which of these permissive uses and disclosures to make. So, this is really where I encourage you to go back to your organizational policy and look to see, do you have a policy on what type of information can be shared and with whom, under what circumstances, without an individual's authorization. And then I also have a link in here, the summary of the HIPAA privacy rule from healthandhumanservices.gov. That is also a reference for you. Um, some other permitted disclosures, specifically to home care, might be disclosures to the individual, maybe for colleagues for treatment purposes. If you're working on a care team and you might need to have a social worker be involved, or maybe physical therapy or occupational therapy. And then to public health officials or law enforcement officials when required by law, for example, to report abuse, neglect, or endangerment situations. So there are some unique circumstances. So again, looking back at your own organizational policies in terms of what is required of you, and there can be variations by state also. So those are things to go back and look at organizationally. This I love this slide. This is from the HIPAA Journal, and it's 10 steps to HIPAA compliance for home health care. And so it's just a nice visual and that could be used, to post as a reminder for folks in terms of, what that process is. One thing in here that we haven't talked about yet is having a privacy officer. So, someone, this is again a good question to go back and ask your organization, who is the person who's responsible here is our privacy officer, right? Larger organizations may have an individual, smaller organizations may have a committee or a department that has a lead in that department that's aligned with that. So, you want to know who that person is because they're the person who's looking at all that federal legislation, state laws and requirements, and they are likely the person who's driving the policy that you have in your organization based on what they know and their training. So when we think about working in that home setting with our patients, some examples of violations might be, sharing protected health information to family members when a patient has objected to the disclosure, or if you don't know, if they don't want that information shared, right? You don't want to talk about it without that permission, that consent. Disclosure of more than the minimum necessary protected health information, and a disclosure of protected health information on social media. So this is a big one, right? We want to make sure that, gosh, I had a bad day, my shift was horrible, I had to do X, Y, and Z. You do not want to post anything about your work, issues, anything related to any patient care, even if you're not saying the patient's names. You don't want to put anything out on socials and Facebook, Instagram, TikTok, anything. Same thing in hospice. There's a few points to consider. Hospice patients often have volunteers that are considered the same as employed staff when it comes to HIPAA. So they have to have the same training as internal staff do, so that they understand that they are also held to the same regulations that staff are within an organization. They're also subject to the same sanctions as professional employees for violations related to HIPAA, and hospice personnel can discuss protected health information of a patient with an unauthorized family member or other individual once the patient has passed away if the conversation relates to payment for services provided, unless the disclosure of protected health information is inconsistent with the prior expressed preference of the descendant. So if you're like wrapping up, financial bills and things related to that after a patient has passed away, unless there's something specific in writing. And so sometimes there's some work that needs to get kind of cleaned up after the patient has expired. And it can be also, those patients that have been identified, or people who have been identified by the patient that is their DPOA if they happen to have someone. Hospice also, using patients' names or images in marketing and fundraising activities is a breach of HIPAA unless the patient whose name or image is used, and this is, I guess, isn't really specific to hospice either now that I think about it, home care as well, right? Any organization, unless there is, somebody who has authorized that, whether it's the patient or their appointed representative, you have to have informed written consent. And even when you think about memorial services that are done within hospice settings, we have to be really sensitive to that as well, and not identifying patients unless there are, they've given the in writing, or their family has given in writing the ability to use their names. And so generally, they're more of a generic service where in a memorial, without giving detail out of the patients that were passed away, to be careful and protect that information. So here's a couple of examples. Unauthorized access to patient information. A home health aide accesses the medical records of a family member receiving care from their agency without a valid reason related to care. So that's a HIPAA breach, right? We never look for people we know. Oh, I heard about X. You don't want to go and look for that information to find out what's going on. Doesn't matter what your role is, who the person is, you don't go seek that information because you're not a part of their care. Inappropriate sharing of patient information. A nurse discusses a patient's medical condition with friends on a public social media platform, mentioning specific details about the patient's diagnosis and treatment. So, again, even if you're not mentioning the name of the patient, talking about your patients on social media is taboo. Negligent disposal of patient records. Patient files that contain PHI are found in a dumpster instead of being shredded or disposed of securely. So again, leaving that PHI in an unsecured location the copy machine, outside the scanner, in the med room. You don't want to have papers laying around or pieces of paper. If you printed something and, or you see something that somebody, didn't see with PHI on it, you want to be able to get it out of there and get it to the founder or the owner, or dispose of it in a secure way. Failure to secure electronic devices. So this happens a lot in home care. You step away from your device, you step away from your bag, and your device is in your bag. You leave it in your car. It's in the back seat. You run in to do X. Here the example is using a personal tablet to access patient records and leaves it unattended in a public area while on a home visit. So we want to make sure that we're protecting that device at all costs. Discussing patient details in public. During a lunch break, a home health aide discusses a patient's case loudly in a public cafe, not realizing that others can overhear their conversation. Violation, again, is sharing information in a public space breaches that patient confidentiality. Using unsecured communication channels. A nurse sends a patient information via unencrypted email to a colleague instead of using a secure communication system. That's again using those secure um, fields or processes that our policies have outlined. Um, Here's a couple others. Inadequate staff training. A new staff member is not adequately trained on HIPAA compliance and inadvertently discusses sensitive patient information with someone who is not part of the care team. So, a lack of training can lead to unintentional breaches. So we want to make sure we take accountability for ourselves and our own learning, and that our organization has a process in place to assure that we have access to those trainings and get those trainings and those updates on a regular basis. Failure to document consent properly. A caregiver fails to obtain proper consent from a patient before discussing their condition with a family member, relying on verbal agreement without documentation. So, again, without proper documentation of consent, the sharing of information would be considered unauthorized by HIPAA standards. So, that documentation of who, what, and what they can receive, or when they're being given choices and they're making decisions, we want to make sure that our documentation is clean and shows everything, right? It's not documented, it wasn't done. So we want to make sure we're doing a good job with that. Um, Here's my example of a coworker or a home care worker prints patient records and leaves them unattended in a vehicle while making a home visit, exposing them to potential unauthorized access. Transmitting PHI without encryption. A home care agency allows staff to use personal email accounts to send patient health information which lacks encryption. And all these things are, we think about in terms of workarounds, or we just do without having a second nature, thinking about the implications of it. We just kind of want to quickly get it done and move on to the next task. So you have to be really sensitive to those workarounds, those workflows, and use the processes that are outlined in our organizations, because they are there to help assure that we are protecting that information and then ultimately protect us from any issues. Social media tips. So I already talked about not talking about patients, even in general terms. Don't mix personal and professional lives on social media. Never, never take a picture of a patient, even with your phone, without a signed consent, and know your organization's social media policy. I know sometimes some organizations have protocols around, taking a picture of like skins. I'll think about wounds and wound care and adding that documentation maybe to a medical record. You have to make sure you know your policy and what that looks like, patient consent to be able to do it, and look at your policies for guidance on that. So these examples demonstrate how easily HIPAA violations can occur in home care settings, often due to oversight, lack of training, or negligence. We have to make sure in our settings that we're implementing training programs and security measures to protect patient information and ensure compliance. And some of that is auditing and making sure that we're tracking staff attendance, tracking staff competency, and that we have policies that are available to staff and they know how to access them and where to access them, and they're current, right? Has somebody reviewed them? Has somebody reviewed your policies, and are they up to date? So what are you doing, or how are you doing when we think about best practices? So kind of do a self assessment in your head. Do you have a HIPAA training program in your organization where all staff, including new hires, receive thorough training on HIPAA regulations, privacy, and security requirements? Do you have audits where you're doing risk assessments to identify potential vulnerabilities and implement appropriate safeguards? Do you share that information in your team meetings or your huddles or your stand ups so that people know what we're working on, where our opportunities for improvement are? Do you have a robust data backup and disaster recovery plan? Right, we're all across the United States, and every community is at risk for some kind of a disaster, whether it's a fire, a flood, a hurricane, a blizzard, an ice storm. We all have disaster opportunities, right? So you want to make sure that your policies have a process where data is regularly backed up and a comprehensive plan is in place to restore operations in the event of a disaster or breach. You know how, and a lot of times we go to a paper process for some of those things, and so then how do those paper information get into that health record and then destroyed so that they're not left around unattended? So, what is that plan? Implement access controls and audit logging, so limiting access to patient data on job roles and maintaining detailed logs about access and notifications. So this goes along with the writing of job descriptions and job aids, job codes. What type of access do they have and why, so that your login controls access to that information in the record, and that really helps protect some of the information. And then developing a detailed incident response procedure. So if there is a breach, what is that process to be able to follow up on it and who's involved in that? And then what do you do so that you don't have that breach again or any additional breaches, right? So it's not just about fixing and communicating the one, but it's then also really evaluating those systems and structures that are in place so that you can update them and modify them. Organizational resources. So again, who's your privacy officer? How do you reach or contact them? Policies and procedures. Where are they? How do they access them? How often have they been updated? When's the last time they were updated? You should have a policy on how frequently they're reviewed and updated. And then what training do you get when there are, just annual, but then also new policies or changes to practices? That's important as well. And that's at the leadership level to assure there's a structure in place and, making sure that you are using those resources and staff are attending and have access to them as well. Home care and privacy policies. So, if you looking at your policies, do you have a privacy policy? Do you, does that policy incorporate all of those compliance regulations that are required? Are you clearly communicating your policy with your patients, their families, your employees to ensure that everybody understands their information is how their information is being used and protected? So again, being transparent about that policy, reviewing those policies, do things need to be changed? Staff training, how often are you training? And then what are your data security practices and security measures like encryption, access controls, and secure storage? Who's in charge of that and how often is that monitored and updated? So, along with your, vendor relationships and data communication. So if there is a privacy breach, right, identifying the breach and quickly determine the nature and scope of the privacy breach, you want to take an immediate action to stop whatever that unauthorized access is or disclosure of personal information. You have to notify the impacted individuals, that it's been compromised, what's been compromised in accordance with applicable privacy laws. And then you have to investigate the incident, right? So this is kind of like a sentinel event evaluation. Conduct a thorough investigation, understand how the breach occurred, and identify the root cause. And then you have to have measures to mitigate the harm so that it doesn't continue to not only impact that person, but then spread even further, right? So let's say, for example, thinking on a system level, maybe you had to go to a downtime procedure and maybe you realized that, the paper patient records that you were not printing but writing on maybe one team. uh, staff are carrying them around in their own bags, right? You don't want to carry patient records in your bag. You want to have a process. So how do we, organizationally make a change, and what does that look like so that we're not, we're mitigating that risk for that data on the individual patients on that team or by that nurse or care team member to be available out in the public. You want to be able to kind of come up with a quick, like, this is what we have to do, and we got to get it fixed right away. Investigate the incident, so a thorough investigation to understand how the breach occurred and identify the root cause. You might have to report it to authorities, right, to the relevant regulatory authorities as required by what your state has outlined and what CMS requires. Any corrective actions that need to be in place, right? So address the vulnerabilities that led to the breach. It could be organizational, it could be individual, and then this is an opportunity to learn, right? It shouldn't be punitive, but you know depending on your policies and what your policies are around data breaches, you want to be able to evaluate the effectiveness of the response and identify opportunities for improvement so that it doesn't happen again or continue to happen. And so, in terms of training, this is really, one of those opportunities to prevent errors from occurring or compliance issues from showing up, is making sure that your staff have a comprehensive training on HIPAA and how they understand the importance of protecting patient safety and using examples, right? So some of the examples we just went through here as a team, coming up with potential examples or things maybe that you've seen or things that staff are aware of or staff that have questions, right? A lot of times people have questions. Encourage them to bring them so that you can dialogue with them and talk about, what's appropriate, what's not appropriate, and people learn from each other. And then, what are your organization's protocols and policies? You want to make sure that you are providing them in a way that people can understand them, know how to access them, and know how to act on them. So here's an example, a case study, Mr. Thompson. Mr. Thompson was one day a Green Valley Home Care Services employee. A home health aide named Sarah was assigned to care for an elderly patient, Mr. Thompson, who had recently undergone surgery. During her visit, Sarah learned sensitive information about Mr. Thompson's health condition, including complications related to medication and his recovery timeline. After the visit, while waiting for a public bus, Sarah engaged in a conversation with a friend. During this discussion, she shared details about Mr. Thompson's health issue and other private information, mistakenly believing that her friend could not hear her. Unknown to Sarah, another passenger on the bus was a neighbor of Mr. Thompson who subsequently overheard the conversation. So the neighbor, concerned about the breach of confidentiality, alerted Mr. Thompson's family, and they immediately contacted Green Valley Home Care Services to report the incident. The agency conducted an internal investigation and found that Sarah indeed had discussed details that violated HIPAA regulations as a patient, and information had been disclosed without consent. So the consequences for the employee, Sarah was reprimanded for actions which included a temporary suspension regarding further investigation. She underwent additional training on HIPAA compliance and the importance of maintaining patient confidentiality. From the organization, the home care agency faced potential fines from regulatory bodies due to the breach. Green Valley Home Care Services had to notify Mr. Thompson and his family about the breach, explaining the steps that they took to address the situation and protect patient information moving forward. And for the patient, Mr. Thompson felt a loss of trust in his care providers, leading to increased anxiety about confidentiality and his personal health information. Despite reassurance and improved privacy measures from the agency, Mr. Thompson requested a different home health aide for future visits. So the lessons learned here, the importance of staff training, the clarification of what those policies are. And when we think about those policies, really, again, that dissecting and the application of what that looks like for field staff and administrative staff. And, it's not just reading the policy, but let's talk about how this policy applies to real life situations so that we can walk them through. Also, having a reporting system, right? So that we wanted to make sure that our patients or their families know if there are suspected breach, who they can call, and what does that look like within our organization. And then shoring up our communication protocols, making sure that we have them in place and we're communicating what they are so that our staff know what they are. So, in summary, this is just a good overview of an innocent conversation that can lead to a significant HIPAA breach within the context of home care. And it underscores the importance of not only being aware of what those policies are, and supporting staff through training and knowing, what and how and where they can communicate that information so that they aren't inadvertently making a breach. So know what those HIPAA regulations are. Take a hard look at your training, education, and your resources, and are there opportunities to, evolve into, more role playing or discussion about situations that come up in the field. Take a look at your technology platforms and how secure are they, and your EMR, vendors and the data exchanges that you're using. What does that look like, and how we communicate with each other in the team, internal to our work and external. How do we protect our physical records, those laptops and phones and devices? When we're doing a visit out in the field, what does privacy look like? How do we assure that we're having a private environment so that we can have these conversations directly with patients in a way that they feel that they can, talk to us and share with us and not have anything overheard that they don't want to have overheard? And documentation, right? We want to make sure that we're documenting, and any people that are you know able to have information, what information they can have, and then consent. The patient is aware and knowledgeable about what their procedures are, and that they are giving uh, completing their consent, right from the very beginning when we are, starting to work with them in terms of, you know, their agreement to how to proceed and what they want to be involved in, and they understand the services that they're going to receive. Reporting and responding to breaches, so having a process to look at that and look at them and investigate them and follow up with them and rectify them. And then an ongoing process to monitor to assure that we're keeping things in compliance. So, again, in conclusion, protecting patient privacy and adhering to HIPAA regulations in home care and hospice is crucial for maintaining trust, ensuring quality, and avoiding legal consequences. And by focusing on, the key points that we talked about today, healthcare staff can contribute to a culture of confidentiality and security in patient care environments. Thank you, and have a great rest of your day.